Welcome to another Journal Club session. I hope you enjoyed last month's topic that looked at a quality improvement initiative in a low-resource setting in Pakistan. If you missed it, don't worry. You can always access it through the YouTube channel. Are you watching this alone or have you gathered a group of colleagues to watch it with you? If you are alone today, maybe consider watching with colleagues next time. You can access a guide how to organize colleagues watching together in the description section below. This month's article is titled Role of the Nurse in Partnering with Mothers to Give Oral Medication to Their Hospitalized Child, Modification and Development of a Contextualized Evidence-Based Practice Guideline. It was written by Harris et al. And published in the journal Curationis in 2021. Let's first look at the graphic summary of the article. This graphic breaks down the different sections of the article and provides a visual summary. In this video, we will now unpack each section. If you have a copy of the article with you, you could track the sections of the article as I speak. We start with the introduction that you can find on the first page of the article. Globally, medication errors are a common cause of adverse events in hospital. In pediatrics, majority are due to dosing errors, omissions without a valid reason, and failure to record. In African settings, medication error occurrence varies, but it appears to be higher in pediatric settings than for adult patients. In pediatrics, medication needs to be checked by 2 registered nurses before its administration. In sub-Saharan Africa, staff shortages make this a particular challenge. In many African pediatric wards, caregivers are present to assist with daily activities, and nurses commonly give medication to the caregiver for them to administer. It's common for nurses to hand over medication to the mother or caregiver. However, this is usually informal and often an invisible practice. The law and ethics of the practice is also unclear. It highlights a gap in the evidence base, particularly in developing countries, where a high level of caregiver delivery of care is the norm. Therefore, the aim of the study was to develop a contextualized and adapted evidence-based guideline to facilitate the safe partnering of nurses and caregivers in the administration of medication to children in a South African setting. We now move on to the methods section of the article, where the authors explain how they gathered their data. You can find this on the second page of the article right after the introduction. The study followed a 6-step method for modification of an existing evidence-based practice guideline. The authors followed a population concept-context approach where the population was the children and their mothers. The concept referred to the mothers administering their child's oral medications, and the context was pediatric wards in a lower resourced healthcare facility in South Africa. Step 1. The authors conducted a structured, transparent, and replicable search to identify existing guidelines related to the topic. In Step 2, the quality of the identified existing guidelines were appraised by the authors using an existing tool, the Agreed To instrument, to assess guideline quality. After that, the recommendations from each of the included guidelines were tabulated along with their rationale and associated evidence. Step 4. The list of recommendations was assessed using prompts adapted from a UK National Institute for Clinical Excellence tool. Decisions were made for each recommendation, whether to include the recommendation without modification, to include it with modification, or to exclude it altogether. This ensured appropriateness and applicability to the local context. The authors consulted content experts such as an advanced pediatric nurse practitioner and postgraduate peers to further enhance their recommendations for their adapted guideline. For Step 5, the authors scored the recommendations for evidence of efficacy and assessed rationale for quality, considering if supporting rationale was required or existing rationale needed to be strengthened with evidence specific to the setting. And finally, the authors created a flowchart to ensure accessibility to the guideline to nurses. Moving on to the analysis and results, which can be found on the 4th page of the article. 2 existing guidelines and 1 policy statement were identified and appraised before accepting for modification. The priority areas for guideline modification focused on supporting nurses to partner with mothers or caregivers to give medication to their child, working within a well-defined professional and ethico-legal framework, and actions to prevent the most common and most serious types of reported medication errors, such as omissions without valid reason, failure to record, and wrong route of administration. 40 recommendations were identified, of which 21 were excluded. The remaining 19 contained similarities, so it was edited to produce a final list of 12 recommendations that required modification. The 12 recommendations were then categorized into 4 themes: assessment, teaching, implementation, and documentation. Scoring and expert consultation confirmed that the Adapted Evidence-Based Practice Guideline was suitable for the intended audience and setting. Table 2 on page 5 of the article details these recommendations. The flowchart, figure 2 on page 8, is the end-user document developed to assist the nurses at the bedside to partner with mothers or caregivers. The authors included an assessment tool to support nurses in responsibly delegating to mothers after obtaining their consent. Brings us to the conclusion. The rigorous process followed by the researchers successfully led to the development of a modified evidence-based practice guideline, enabling nurses to partner with mothers or caregivers in safely administering oral medication to their children in a South African setting. Nurses working in pediatric settings can use this guideline to provide safer care to children through a reduction in medication errors. Limitations of this study. The process ensured that all recommendations were supported by evidence, but it was limited by the availability of evidence. It was beyond the scope of their study to undertake a systematic review for every recommendation. Therefore, further research was suggested to build the evidence base. Prior to implementation of the Evidence-Based Practice Guideline, the authors recommend that the nurse with overall responsibility for medicine management on the ward, the head pharmacist, head clinician, and nursing unit manager should agree on which medications can and cannot be handed to mothers or caregivers to administer to their child. The ultimate responsibility for medication administration and assessment of the child's response to the medication remain with the nurse. We've come to the end of the video, and so now you need to access the article. The link is in the description box below, or maybe you already have a printed copy. We really encourage you to read the article in full, recognizing the parts that we have just summarized for you. After you've done that, consider the reflective questions here on this slide. If you are watching with colleagues, discuss your answers between you. Following that, take a moment to think about what you have learned and how you could apply it to improve nursing practice in your setting.